Hello viewers, Assalamu alaikum, welcome back. This is Dr. Abid. Viewers, in our today's lecture, we are going to discuss very important topic, that is wound and its management. So let's start our lecture with the definition of wound. So first of all, what is wound? Wound can be defined as a break or disruption in the continuity of tissues of any body part. Either there might be internal wound or external skin wounds. So any of the disruption or discontinuity of the tissues is considered as a wound. Wounds are mainly caused by physical. Physical means that there might be any kind of trauma, accident, or by gun shooting, etc. Or chemicals, just like biological reagents or hazardous chemicals are used, which may result in the, if not handled properly, they might be harmful for the skin or body tissues, which results in the wound. And other biological insult, just like any of the systemic disorders, may cause the hematoma or rupture of the different types of the tissues or blood vessels, which may cause internal wounds or external wounds also. So what are the degrees of wounds? Before going to start our lecture on the uh, types of the wounds, I would like to suggest that degrees of the wounds should be studied. So here wounds are generally categorized into three categories, just like first degree wound, which refers to the rupture of capillary vessels of the skin and subcutaneous tissues to form ecchymosis. This is considered as a first degree wound. While in second degree, larger vessels are ruptured, leading to the formation of hematoma. While in third degree, tissues are damaged and gangrene may set in. Here, the gangrene, what is gangrene? I would like to suggest that gangrene is a term which refers to the putrefaction of the tissues, which results due to the accumulation of different kinds of the gases productive bacteria, and putrescine and other chemical reagents are produced which smells putrid. What is seroma? Seroma is the closed collection of serum, probably as a result of chronic hematoma in the body tissues. While hematoma itself is a collection of blood in any of the abnormal cavities within cells, tissues, or body organs. What are the common sites where wounds happens routinely or more frequently? While most of the times in cow, mammary veins, vaginal mucous membranes are exposed to the external environments, which may cause the are the sites for the wounds. And in bulls, mostly wounds are seen in the external genital organ, and in dogs, ear flap, and in females, vaginal mucous membrane may also be infected, or any kinds of the ulcers may happen while due to possibility of coitus or any of the other reasons as well. Here, what are the types of wound? Wounds are categorized as the abrasions. Abrasions are wounds in which the superficial layers of the tissues have been destroyed by friction, exposing the sensitive tissues. Here you can see in the picture, this is the abrasion wound. This is the contusion or bruises, in which there is injury to the skin but without any break or gap in the continuity of tissue surface. Depending upon the extent of the injury and the tissue involved, contusions can further be subdivided into three categories. Incised wounds refers to the wounds caused by sharp objects, like any of the sharp edges in the houses, in which there's minimum loss of tissue. Such wounds heal by primary intention, which we are going to be discuss in our next video, that what is primary intention, what is secondary intention in wound healing lecture. Here is the penetrating wounds. It is caused by long pointed objects and may communicate with body cavities. It can also be differentiated from this later, that incised wounds, that These are the sharp objects, but only just a lateral side. But in case of the penetrating wounds, it is deeply into the body tissues. These are also called gored wounds. Lacerated wounds, it refers to wounds caused by tearing of tissues inflicted by barbed wires. Such wounds have zigzag borders. Here you can see in the pictures clearly that there is a zigzag manner of the borders of the wounds. Other one is gunshot wounds. Gunshot wounds are caused by firearms. This wound may be incised, lacerated, or contused depending upon the velocity of the missile and other related factors. Just like depending upon the incised wound, there might be any kind of the bullet is passed, but only touching the skin of the body, or lacerated or contused if there is deep wound. Poisoned wounds, sometimes these cases have been seen in the clinical conditions that sometimes owners complain that my pet has as wounds on the belly of the belly region, especially inguinal regions. These are mostly caused by various types of poisons or the toxins, either externally or leaking on the surfaces, etc. This is the bite wound. Here you can see in the picture clearly. It refers to the bite wound, which may be due to bite or fighting during fighting. Virulent wounds. This virulent wound refers to the cause of virus, like just like in FMD and foot and mouth disease in large animals. Here you can see that there might be pustules or the ulcerations on the uh, tongue and lips. In anthrax and tuberculosis causing organisms, these are called as virulent wounds. While ulcerative wounds, which has no tendency to heal, there is continuous skin scrapings happens, and skin is going to be disrupted regularly, but not healing. Erosive wounds, in this type of the wound there is shallow area of necrosis confined only to the epidermis. Here you can see in the pictures clearly. While in punctured wounds, these wounds are usually deep and are more prone to anaerobic infections. These mostly happens or have been seen in cases of bites, like in cats, dog bite happens, or in cats itself from fighting with other cats. There might be deep wounds due to the canine teeth insertion into the soft tissues. Here is the envenomed wound. Envenomed wound refers to the bite of the snakes, ants, wasp, or scorpion, etc., in which most probably sign of the envenomed wound is that there is unclotted blood bleeding from the natural orifices, especially in case of snakes. Here's aseptic wounds. Aseptic wounds means there's no infection encountered yet and skin appears yellow and there's no any kind of the pus accumulated. Septic wound or infected wound is the most common or the most serious condition in which microorganisms have been invaded the tissues and started multiplying through via spreading into the multi-systems through blood. A contaminated wound may become infected after a lag period of 6 to 8 hours. This have been seen in case of chronic wounds, and wounds are not healing properly and they are not responding on the regular wound treatments. Then it may be considered that animal is in shock or animal is suffering from the septic wounds. Contaminated wounds in which microorganisms are present. Strictly speaking, all wounds other than aseptic wounds are contaminated wounds. This is the crush wound. is in which severity of the trauma is maximum and the status of tissue is completely distorted. Such types of wounds are usually encountered in accident and very much prone to necrosis or gangrene. Here you can see that whole body, whole of the hump of that this cow has been distorted. Maggot wound is common clinical condition in which the live or dead maggots are visible. This refers to the maggot wound. This is the short life cycle of the medical maggots. Lucilia sericata is a house is a fly which is responsible for the causing this condition, in which eggs are laid on the site of the wounds, externally abrupted skins, then which converts into the larvae, and then larvae matures into the pupae, and then later on they are converted into the adult stages. Avulsion wound. Avulsion wounds is a wound in which substantial tissue from the body is lost during the injury. It mostly occurs in horn and hoof cases, where tissue is lost due to the fighting between the animals. Then horn and hoofs are disrupted, or horn is totally removed during fighting. Granulated wound is one in which excessive granulation tissue is present, here shown in the diagram. So in our next video we will be discussing about wound healing. Thank you very much for kind seeing these videos. Hopefully you will enjoy it and subscribe my YouTube channel for support. Thank you very much.